So I started my journey with AUSN a few years back. So I started as a student of Masters of Bioethics and Global Public Health, and from then on I continued to be, I felt good with Gary all the time because I learned a lot, and also with Dr. Rai and other people as well. When I meet them and then talk, and I learn a lot. So so I'm affiliated with AUSN. And currently I'm teaching in a college here, in a higher, national diploma for health and social care. So, but my core interest is bioethics and public health. Today, what I'm going to present on one of my published papers. So it's basically on the water ethics, and it's very much related to India. So thank you very much. So I just proceed with my slides. So now I want you to say, what do you think about this picture?
What?
Sorry? What do you think? What it is all about?
This is ocean.
Speak loud.
Do you need a microphone?
No, don't worry, I can speak loud.
Okay.
It's the ocean.
It's the ocean? Okay. Any other alternative answer? What it is all about? How do you feel when you see this picture? Do you feel very morose, very sad, or do you feel very joyful, very curious? What's there? Do you want to see what's going on here? How do you feel?
Relax.
Relaxed? Yeah, that's good. Relaxed.
I want to see what's under the fishing boats.
But the cloud,
That's interesting. Yeah.
but the cloud is not sky blue color. It's hazy or dull in mood.
See, you are not very happy to see the picture. It's making you a bit sad. You want to say that? Or comment that? Okay. So I think same with Darren, because he said what's under the fishing trawlers. He wants to see that, what they're doing. Well, this is actually not a sea, right? There are three rivers actually meeting here, and it's very close to the mouth of the sea. So mouth of the river. So it's very close to where the river is meeting. And this is the main river in India, so Ganges, where the Ganges meeting the sea. And it's so wide, you can see from one shore to the other shore, you can't see that. Okay? But we feel very curious about this picture, isn't it? That's a common expression. Somebody wants to see what's there under the trawler, somebody is to say that, okay, the sky is gloomy, probably it would have been nice if it was clear. Yeah? So we feel interesting about it. Right, what do you think about this picture? I don't know whether it's very clear here. It's the shoreline here. It's going under this water here, and you can see these blocks, the bricks here are broken. So what do you think about this one?
Isn't it a farm? Like you've got the farm.
There's a
I think there are farms next to the sea.
Farms of fishing farms?
Yes, it's like a field. You look in the UK, in the countryside, you see the field. Some of them is not cultivated, some of them do. I'm not sure I'm right or not.
Cultivating fish or what? The farming fish farm or
No,
what?
it's just I think it's just farming for just vegetable food. It's not a fish farm, because I think I read what fish farm is like.
Okay, so basically this photo was taken, it's on the nearby to the same place. You can see the fishing trawler, very hazy there in the background, that side. But it's nearby to the same place of the earlier picture. What's happening here from the government, they tried to make the concrete shoreline so that it can stop the erosion. But the river is so wide here and it's so dangerous here that they couldn't stop the erosion. So it's breaking down and it's going under to the river, inside the river. It's going down.
So it's not as sorry.
Yeah, no, okay, that's fine. So in contrast to the earlier picture, where you can get an opportunity to be more curious and more interested, this picture is a bit of sadness, because it's something is breaking and just going inside the river gradually. That's the thing we can get from here. So both of these combining these pictures, what we can say that water can be the source of our joy, and water can also be the source of unhappiness and sorrow. Okay, it can break the shoreline and it can just take everything inside it. So it can do both. So sometimes it can be the source of misery and sometimes it can be the cause for the woes of our humans. Now when I relate to the water to the human health, we know that the depleting water level, this water is becoming scarce and scarce day by day, and it's affecting us in different forms. It's affecting us through its availability, accessibility, and also through the scarcity. With this reduction of the water level in the world, there is an increasing levels of the waterborne diseases. There are increasing conflicts about the water within the countries and in between the countries as well. And what's happening here with all of these three things, basically the human health is getting affected. Because the conflicts, especially in India, when it's happening in between the different castes or different groups, sometimes it becomes so violent that one set of people or one group of people, get physically harmed by the other group of people. Okay, so whatever is happening with the water, it's basically affecting the human health, and where some suffers, some groups of people suffer more than the other groups of people. So through this paper, what I wanted to show that whatever is the scarcity of water, the lack of availability of water, lack of accessibility to water, is basically causing a health inequity or health gap in between the groups. And that health inequity, if you see it from the apparently it says that it's just a health gap, but basically it's a gap in the human health capability. That is what I wanted to show through this paper. Now when it comes to India's resource of water, India's water resource, it says that India supports about 17% of the world's human population, but it consists of only 4% of world water assets. So that's not enough. 4% of the water assets is not enough to feed the 17% of the world's human population. Now the whole nation is comprised of the 20 water units with 14 river basins, but there is a spatial imbalance of how the total water asset is divided and dispersed among the 17% of the world population, say in India. And also there are the misuse of water, so leakage, inefficiencies in the water management, which is leading to the 50% wastage of the usable water. Some of the issues, explicit issues that we can say from the water resources in India is the severe groundwater exploitation. So the water for the farming and agriculture in India, it comes from the groundwater exploitation mainly. There is a shrinking storage capacity because most of the peninsular river basins in the south, in the north as well, so they are almost dried up. So they can't carry enough water which they used to carry before. And there are water conflicts as well, both internal and external. Say two of the provinces in the southern India, every year they are in the headlines in the newspaper, the Tamil Nadu and Karnataka. All the time they are in the newspaper because of they can't share the river water properly every year. And and also the external conflicts as well, with the China and India, there is one. And who is suffering because of this dispute? Then Bangladesh suffers. Yeah, because it's the same river flowing through the country, three countries, and then again India and Bangladesh, they have the same problem sharing the Ganga river water. How much they will share from here and it's going to the other. If they share so much, if they cross the limit of sharing, then the Bangladesh gets flooded. So that's a conflict going on every year. So India Water Portal, that's a bit of old figure, so they state that there are 128 areas of water conflicts, both external and internal in India. It is about the usage of water, it is about the availability of water, it's about the scarcity of water, and it's about the accessibility of water. So they identified 128 areas of water conflicts in the country. Now, when we connect to that, because my main point is here to connect the resources of water, the crisis of the water, and how it's affecting the human health, basically in India. Now, some of the the provinces, say in India, there is a tremendous, high rate of waterborne diseases. Say some of the northern states and some of the southern states, due to the waterlogging and seepage in the canal catchment areas, the malaria is very significant there. Every year they come to the news again, especially Uttar Pradesh district. So every year the children under 5 they die of this epidemic and the endemic diseases there. Now in recent years, surprisingly, there is a high rate of other waterborne diseases, which are then, because they give rise to when there is a water clogging or water logging and the high seepage and in the catchment areas, they give rise to the mosquitoes, they give rise to the butts of the mosquitoes, and that spreads the other diseases. So there is a surprisingly high rates of chikungunya, filariasis and cholera in almost all the states of India. Now waterborne diarrhea, that is one of the biggest killer in India for the children under age 5. So they causes 1600 deaths daily, and 21% of the communicable diseases in India are related to the unsafe water. Although government is trying hard to provide the safe drinking water to all the citizens of the country. Now with all these kinds of the issues, these different issues of water in India, we can see there is a distinct, disproportionate impact on the people of the country, on the Indians. There is a distinct divide between the rural Indian people who are getting more affected due to the water scarcity, water availability and the waterborne diseases than the urban people. Some provinces, as I mentioned, Uttar Pradesh is one of the provinces there. Those diseases occur annually in those parts, Uttar Pradesh and other northern states, and they are affecting the children there more than the other states. Now, women one-sixth of their lifespan of the Indian rural woman is dedicated to looking for the water. They go for search for water and they spend half of the day in just fetching the water, and they come back, still they don't know actually. When they go to fetch the water, they're not sure whether it's very certain that they will get the water. And sometimes when they come back with empty-handed, then they get also scoldings from the husbands or from the other families. Why didn't you get the water? Why didn't you make the house clean? Why don't we have the safe water to drink as well? So they suffer from the discrimination and stigma. So as a whole, the women here in India, especially in rural India, they get affected physically, emotionally and mentally for this scarcity of water. And as I mentioned, the childhood diseases, diarrhea, waterborne diarrhea is one of the main killers of the children in India. So they are also affecting the children. So some of the groups which we can see from here who are most affected in India are the rural Indian people, rural people in India, some provinces, some state people of some northern and southern parts of India, women and children. Now, this is how affecting them, it's not just their physical health is getting affected, but also they are getting affected physically, socially, emotionally, mentally, right? So if you can remember, say, for example, WHO definition of health, health is not just the physical health, health is more than that. So as a whole, they are affected from different perspectives, from different angles. And what I tried to say is that basically it's affecting how they want to be or what they want to do in their lives. So when these groups are affected more than others, they are lagging behind in what they want to do in their lives. They are lagging behind from other people, so how they want to be in their lives. And that's how their health capability is getting affected. They don't know because they are getting deprived in their health and they can't utilize their health to keep in pace with the other people in the country. So my solution for this kind of problem is we have tremendous number of actually water laws, water policies in India. But the situation is not really changing, rather it's getting affected. I don't know whether you can see it properly. So this is a schema, how actually it's affecting the health capability of the people in the country. So my solution for this problem is that What we need to change is not that the vision in the water policies or water laws in India. It shouldn't be focused on the water as a natural resource. Rather, it should also be focused on how it to be connected with the health of the people of the country. So not just to the water resource in the country, how much it's available, what they're going to do and all. So it needs to be the water frameworks in the country should have a framework of the social justice in them, and they should have a proper vision, say how water is affecting the health of the people. This vision is to be there, and water is mainly to be considered as a determinant of health as a whole, not just for the proper sanitation or proper hygiene as well. So it needs to be considered as a determinant of the human health and human life. And that's all. Thank you.
Thank you very much, Rhyddhi.
Thank you. Yep. Shall I read?
Yes, who would you leave down? Yeah. Who would like to start discussion? Thank you, Justin.
Yeah, water is a big issue in India, and it's linked with everything about India, but the system of governance is not very good, and that's where it all, I think, not just water but health and everything, that's where it all falls down and becomes complicated. The different states like Punjab and Karnataka are very possessive about their water supply, and that's led to huge political conflicts with the central government. The central government hasn't really set up a board of people or tried to create an understanding of the difficulties of not sharing water and why it should want, and Punjab's argument has been, as a riparian state, it has right to all the water that goes through it, but then that means it deprives Rajasthan and other states of water. And there hasn't been a comprehensive approach to this with the cooperation of the states, and there isn't also a sense of responsibility in ensuring, as I said, there's a lot of waterlogged places where there are waterborne diseases, public health, that sort of thing is also poor. I think in the end it's about issue of governance. If they can improve the system of governance, they can manage, the water a lot better in India. And the unfortunate thing is it's not a big public issue, it's a political issue between different communities and different states, because it was one of the big reasons given for a separate Sikh state as well, that we don't seem to have control over our own waters, the Sikhs were saying. But it's not, so it becomes a political issue, but it's not a public health issue, not a public issue within the press. Why is management of water governed so badly? Rainwater is not properly utilized. There's a lot of scope for that. Then again, coming back to Punjab, there is the farming policies are not very sensible. Punjab is not a natural state for rice, but a huge amount of water is being wasted because rice is gives more money than, say, wheat or other products. So the farmers are planting rice in Punjab, whereas rice is better produced downstate. So it's a sort of messy governance, really. I think that's where my comment would be.
Thank you. Any other comments? Observation?
Yeah, firstly on our Skype group. Yes, please. Hello. Go ahead.
Rhyddhi,
Yeah.
I think we often work with each other on their papers. it's a very important topic, and I was looking at your PowerPoint presentation, and I was looking at one particular problem here, conflicts.
Can you go to the...
Water conflicts. And Rhyddhi must be aware of the water conflicts that are existing between Bangladesh and India, because Bangladesh is a lower aquatic country, and all the waters that come from India, Nepal, flow into Bangladesh. And if Bangladesh cannot really control its water, then the health of the people are very bad, health and homestay and crops. The reason why I'm saying is that, as you said, scarcity of water. During dry season, the scarcity of water is so much that we hardly have any water coming down from the rivers, from the Ganges, which we call the Patta and the Mekka. And then, when there is a monsoon, then the water is released and there is flooding in Bangladesh. And people are suddenly they find water to be in. And as you know, we have been trying to discuss with our government, discuss with your government, especially with Madam Mamata Banerjee. But she has hearing of, even when your previous Prime Minister came, she did not to share water equally, or actually give some more water to the dry season and not waste so much water in the monsoon season. So your study will be very helpful, because this is something that we will also use, and we will show that these are the things which also affect this part of Bangladesh, and the two governments have special groups and committees, and we have met, I think, thousands of times. Until now, no solution has come, because we are at the receiving end. So I am glad that you have taken this up, because it really affects Bangladesh very bad. The rivers have dried up in dry season, and the cracks and cows are grazing on it. And in floods, we come up and the homesteads are broken up. It's a poor country, and I think, India, Bangladesh, Bhutan, Nepal, all of us have to stick together, like their chance, and look at the regional welfare, look at the regional welfare. Yes, the British have divided us, but we are together all one people. The political dimensions have to be borne for the sake of the people. So your particular thesis will be very important. There may be things, methodologies, so I won't comment on that. It's just a very proposal. But I agree that it's because changing the policy of governments is very, very difficult. And especially the water sharing agreements, this type of never worked out. So it will be good if you look into this, because your research will help us. Thank you.
Hi, thank you for your comments. This is just one of the research papers, so it's not a thesis, just to clarify. And yeah, you're right in one sense, and I agree with Dr. Rai as well. It's a governance issue, but there are certain other things. But if there is no ethics in it, then governance won't be, again, it will be messy. So it will continue to be doing that. So that's my point there. So there has to be an ethical perspective in that governance as well, which can bring changes in the laws and policies of India, especially related to water here. And coming back to the other commentator's comment, it's like, yes, I'm aware of this India-Bangladesh conflict about the sharing of the water, and it's true that the Chief Minister hasn't heard about it. Probably they are aware of it, but they don't want to, devote much time for it. So the problem I think here is because they are very much involved about their own research, but they don't collaborate with the researchers of the country who are working on these kinds of areas or fields. So they are there, if their 5 years policy, how they are working, where it's not working, so what needs to be added there, they just work on that. But they don't collaborate with the researchers, the academics, to work more on that. So that's another point, but that's everything. This is a short version of my whole paper. So, but the whole paper is available it's available online, so it's much detail is given there. But thank you for your comments.
Yeah, Rhyddhi, please.
I think education might be. I think education might be one of the solutions. If you don't educate people how to use water effectively, people tend to don't know, and then they can dispose some of the water which is harmful to animals in the sea. Well, having been in Cambridge, I think there is some kind of the person who dealing with environmental issue, especially when trying to promote how to be very effective using our utility energy like water, electricity, gas. So unless people know how to check, like a tap, or maybe the coil, see whether or not is there any leaking, or maybe government can put a little bit of fund or policy of indicating people to know what to do, because the majority of the water, if it's wasted by leakage, it's unpleasant wetting the water. Well, I have been to India, but I could understand that water is an essence in the Indian culture. And I think one of the things with this situation is, if you don't know how to prevent it, first prevent it as a level at home, and then you prevent how you dispose of this use of the water. This uses of the wastewater in the sea and river, whatever is this. Because I'm not sure whether or not you have this good system of recycled water, because if the water have been contaminated and being reused, it will always create a circle of problem.
Thank you for your comment. Good observation actually. So when you were mentioning about the education, definitely it's an important part, but it comes with the water usage, say from individual households to the bigger populations as well. So definitely it's an essential part there. But yes, that policy is there. They're trying to introduce that how to use the water efficiently, so there is not that scarcity later on during the summer and the dry seasons. But that's one part. But the other part is the availability of the water, how the government is supplying the water, how much people can actually access the water to live a decent life. That is another problem. So the problem is bigger and the problem is smaller as well. Within the state and within the blocks of the state, different parts. So in the whole country, then in some states, and then within the states and within the blocks as well. So the problem is very vast. But there are a number of policies and laws in India to deal with that. But none of them are implemented in such way, or none of them are that strict so that they can control these, scarcity, or they can control this leakage, and they can increase the efficiency of the households and all. It's not. Say, every summer, just to give you one example, every summer, you have been in India, you mentioned, so I don't know where you have been.
I haven't.
Okay, so the Mumbai is one of the biggest cities in the western part of India.
Just talk about it.
Yeah. So every summer, the state government, the Maharashtrian government there, so let me say it in this way. So when you are living in a capital city, you expect or you deserve to get probably you expect to get that every facility is there. So Mumbai is the capital of the state of Maharashtra, one of the biggest states in the country. But every summer, the Maharashtra government, they has to cut the water supply in certain parts of Mumbai drastically they cut it so that the other parts can get the proper supply of water. When the rainy season starts, it started from say 2 days back and all, and the Mumbai is flooding now, waterlogging. Several flights have been cancelled, and there are no public transports available now. So why can't the government take the step there to stop this rainwater harvesting? The first rainfall there in the country, it comes from south, then west, and then it moves to the other parts of the country, the monsoon. But why is not there a facility or policy or law to make use of those water? Why the city has to be waterlogged every rainy season? That's a wastage of water in a sense, because you are not storing or harvesting the rainwater properly.
Yeah, I see.
And the sewage system is not proper because your rivers are blocked. No, unfortunately we don't have that kind of recycle facility, recycling of the water. We don't have that.
Yes, I think, well, I know, originally I was from Thailand, and a few years ago, Thailand was flooded. And I think when I went back in 2012, it's in the news saying that the sewage is very small for the water to move itself downstream, and a lot of people actually throw all rubbish in the wherever it's very bad law in the sense that, but it's very bad habit in the sense that people just throw things on the street and then everything stuck in the sewer. So I felt like it's difficult in less developed country to go through the system that you have to recycle stuff, you strict with what you can dispose in the water. In the UK, you can't dispose the fat in there, you can't dispose paint. So I think it's very hard, and you say the system, the governmental system in India is very complex. It wasn't run by the central government, even though the central government seemed to run some important parts, but you say it's in the state itself.
It's a shared responsibility actually. So when it comes to the central, they say it's a state's responsibility, so the province's responsibility, and when it comes to the province, they say we don't get enough funds from the central, so we can't. There are continuous some BBC documentaries are on the Ganges. 2-3 documentaries I have seen, and it shows that it's the sacred river in India, but in certain stretches it is the most polluted. You can't even imagine how much pollution is there in Ganges.
Even the wet rainwater, if they were to come down to the ground, you can't use it because it's access from the air, from the polluted air.
Yeah, but when I went to Manila for the Asian Bioethics conference, the river I have seen there, the hotel where I was staying, there was a small canal, and flowing just by. I can see it from I could see it from my window there, and I feel very sad, because it's full of plastics.
Yeah, it's quite interesting though.
Because it's a problem of not just India, from different Asian countries, developing countries there.
I think it's. I think in Thailand the same. I remember my sister flat is next to we call it the river or canal. I think it was full of plastic and it was black and smelly. So I think a lot of children still going into the water, but possibly they have grown resistant on that. And I was just thinking, even though, I mentioned the education, but people have it still there, and the system of collecting the waste is not as perfect. As maybe I live in Cambridge, I got the privilege of the people come to take the rubbish, and then we have the very good policy and awareness about recycle or plastic stuff. And now it's going to be the new law about the plastic straw.
That's because of that we will see the documentary and awareness. Yes. Well, when I came here, I was told that the River Thames response was very, very dirty. I don't know, maybe Darren and Dr. Rai can tell more about it. But then the country as a whole, the government took the initiative to clean the water, and it's very clean now.
Yes,
We don't get to see any plastics just flowing on the River Thames.
Yes,
So that's the difference.
yes,
So the government has to come somewhere with a different vision. So it's not just the water. You don't need to see it as the resource, but you need to see what the resource is doing for the human health,
yes,
how it's affecting us. Yeah, you need to think about it as well.
yeah.
So that was the main aim of that study. So
That's right. Any comments or questions? What about Bangladesh water?
Bangladesh is and Pakistan are both, there's a potential of conflict with India on water issues.
yeah, water.
Sonia?
Why you choose the water related to India? What is the
No, actually, if you ask me about my research interest is health. Okay? But when I was taking the course under Darrell in AUSN, I got interested. I read one of Darrell's articles on water ethics, and I got very interested on the water ethics. And as my background is, my own PhD is on human health, so bioethics and that public health. So I wanted to do something by which I can connect this. And water is one of the determinants of health. Yeah, we see the lack of access to water is one of the determinants. So I thought to do something. So this published paper is basically, it came from my master's thesis from AUSN because I focused on the water ethics. Yeah.
So you both in the UN.
Yeah. So that's how I focused on the water.
water is a
And I felt because if you are in India in summer, you can feel the pain from not having the water.
Oh yeah.
Yeah?
In summer.
Water is because you can see the tremendous wastage of water there. When the water supply comes, from the government is now giving from time to time, but twice or thrice a day, the government actually supplies the water there. So every locality has got the, that's the UNESCO booklet on the water ethics. So I got very influenced from it and inspiration. So thanks to Darrell for inspiring me to work on this. Because I got involved with this paper.
Yeah, that's quite interesting. I just want to mention a friend of mine said, and she's a biologist as well, but she said that somehow we put so much chemical in the water and fish start to change its gender from normal gender, like there is more, you will have more, female fish than the male one because of chemical affecting the body, the fish.
Yeah. On that note, I can say one thing because in India, the separate literature, they mention about 5 elements, and water is one of them. In Veda, you see the separate literature of the Hindus, there is mention of the elements and one of them is water. So water is very, very religious in that sense, especially Ganga water. What water are we doing to the Ganga? We're just polluting it because our infrastructure is not that proper to clean the river, but we consider it as sacred. So all these thoughts came behind, me to just, and then Darrell just pushed me to this, influenced me to do this, to take this topic. So that's how I got interested.
So if India only has 4% of the world water assets, yet it also has a challenge because, as we talked about, Hannah mentioned, like the Tesla River and other rivers have a conflict. But actually India is starting off at a very low situation of water. That means in the dry season, the neighbouring countries are even drier.
Oh, it's drier, yeah. That is what's happening, actually.
So, how can we make more water? Do you think desalination is a reasonable option?
Sorry?
Is desalination a reasonable option?
Yeah, that is one. In the river, all the major rivers in India, they go through the desiltation. We say that they are. So they take the rubbish and take the mud out so that the water flow is proper. That is one. But I think what Dr. Rai mentioned, that rainwater harvesting. India get a massive rainfall. huge amount of rainfall. So the rainy season is one of the biggest seasons in India, and just Indians just look forward to that, the rainy season. So why not just think about these alternatives? So that, and also the recycle methods and everything, so that the sewage gets blocked before going into the rivers. The sewage canals, they need to be treated as well. Yeah, so there are different alternatives that need to be thought of, but the laws and policies, they need to have a different vision as well. It's not just the water, river, sea, ocean like this. It's not just that. You can't divide it in different components and how much quantity of water, amount of water you got. So what about the quality of lives of the people in the country, how it's getting affected? So they need to think about it as well.
Yeah. Atanasio is from Mozambique. Would you like to make your comment orally as well? He says the issue of water is a great challenge in many developing countries, and some diseases are prevailing because of the use of inappropriate water.
Yeah.
So this issue of water, clean water,
yes.
it's important. Okay, any other comments? So does England have enough water for you?
Yeah, I think so. It's metered here, isn't it? You can. So that's a fear on the citizens' mind that you can use a certain amount of water, otherwise your tax will go high. So why not implement that in other countries as well? So people can have the limit. Because we see the tremendous, leakage, as you mentioned, and all, the tremendous wastage of water on one side and then scarcity on the other side. So we should have some kinds of methods there as well. I think so. So
yeah, I think during the very hot season, they do restrict how much you can use a hose pipe to water plants in the garden. But I think we have the privilege of the technology of recycle the waste of the water. Well, in Cambridge we have a facility of that, and as you say, they know how to treat the water and then let it go to the river, and it can be reused.
Yeah.
And I think the UK, especially Wales, is full of water when it's not the rainy season, but it's still full of water. And some part of the country not export but transfer the water from Wales to use there. So it's kind of luxury for us.
That's the system here that we are in now. So I just want to contribute one thing, that it's not that everything is bad in India about water, because the mindset changing now. The mindset is changing there. So because a few days back, one of the videos was circulating through Facebook, and it caught my attention because one person, he's a government official, in his own life, he never used the supplied water from the government. He and his family, and there is a good plants and trees in his house, and he is well maintained in that sense, because what he does, so the alternative option is he's harvesting rainwater, and he lives in Mumbai, in Maharashtra, which faces the water scarcity, and then it's got waterlogged there. So he's using the rainwater, harvesting the rainwater and using it. So that's his process. So things are changing there, but it's very slow, but laws and policies are very much stricter. So that is another part what I wanted to focus there in the paper. Yeah.
Okay. Well, thank you very much, Rhyddhi.
Thank you.
Thank you.